Homeless people and those who do not have identity documents will now be able to get vaccinated against COVID-19. This comes after NGOs in the sector raised concern about this vulnerable group possibly missing out on the jab due to their lack of documentation. Western Cape Health MEC Nomafrench Mbombo is set to visit the NPO Hope Exchange in the city where vaccinations are due to get underway. SABC News reporter Vanessa Poonah is on the story for us. Let's cross live to her. Vanessa, a very interesting and important story. Just tell us more.
Yes, indeed, and good afternoon to you. An important story because for the longest time, NGOs working in the homeless space have been concerned that those living on the streets in the country may not or may be left behind for a myriad of reasons. One of them, of course, being the fact that a large percentage of homeless people do not have an identity document. And of course, this is one of the issues that was highlighted to the MEC for Health here in the province, Dr. Nomafrench Mbombo, about a month or so ago, when NGOs asked her to come and talk about how they could work together to get homeless people vaccinated. Today at the site at the Hope Exchange, 250 vaccine doses were made available, and I can tell you a short while ago, as at midday, over half of those had already been used. And as we stand here, of course, still we see people trickling in, being registered. Let me bring in here Sister Yvette Andrews, coordinator of this project. Also, Sister, this morning very, very busy. Of course, now we're still seeing people come in. The issue of hesitancy was a big question mark around homeless people and vaccinations. In a nutshell, how did today go and what happened to bring us to this point?
Today's gone fantastically. We are very enthusiastic by what's happened. We've been working with the homeless community for a while now, for a number of years, and we've always kind of had a concern for the homeless community because we're the section of the metro that covers the CBD, and we know that there are lots of street-based people here. And so they were always on our mind. We felt that we needed to create a service which would be unique for them because they are a vulnerable community. And so that's what we did. We spoke to our partners in the NPO sector and we came up with today. And today was to be our pilot project. For us, we felt like anything more than 20 people would have been a success. We're now over 100 and we still have people coming in.
Very briefly, so people that don't have IDs cannot register on EVDS. How then are you assisting those people here with the data or the information they give you? How will it then eventually end up on the government system?
So what we've done is that we've captured all their data manually and that will be kept on a form or a Google Doc until EVDS is changed to adjust to people who don't have formal documentation.
We also understand that the Hope Exchange is one of about 10 sites around the metro, but earlier on speaking to the MEC for Health here in the province, it's also extended beyond just the metro to rural areas. She mentioned Ceres, for example, and although not daily, the aim is to make sure that these kind of outreaches take place on a weekly basis.
Yes, so we do, as I said, this was the pilot site, and since it was such a great success today, we do hope to roll it out. The metro is divided into 4 substructures, and so we'll each take responsibility for our geographic space. So, for example, we will be going to the south, which is like Fischhoek, Wynberg, Strandfontein, those areas. And again, we'll be working with our community partners around creating services which are inclusive for the most vulnerable. So,
thank you so much for speaking to us, Sister Yvette Andrews, of course, at the helm of things here at the Hope Exchange in Cape Town. We do understand, and we spoke with the MEC as well as Dr. Sadiq Karim from the department earlier, that for now at least, with the province receiving additional doses of Johnson & Johnson as well as Pfizer vaccines, that they'll continue this project as long as they have those supplies, but saying that at this point the supplies do indeed look good. Of course, we'll understand that the Western Cape is now in the peak of the third wave of infections with over 40,000 active cases, and all those involved, the health authorities, etc., are eager to get as many people vaccinated as possible to prevent further serious complications as well as deaths with regards to COVID-19.
Yeah. Vanessa, do stay with us. I wanted to ask around the issue of the kind of vaccine that's being used. You do indicate that there's a combination of the Johnson & Johnson, which is 1 shot, and the Pfizer, which is 2 shots. Very interesting circumstances there if the homeless are getting the Pfizer, because, you know, how does then one track that they do come back in time to get their second dose?
And that's exactly what the Health Department said to us a short while ago, that the vaccine being used for the homeless cohort is indeed the one-shot Johnson & Johnson, purely because of their vulnerable status and the fact that homeless people do tend to move around. I mean, just to give you an example, according to the City of Cape Town, their figures of homeless people in shelters, etc., is just under 6,000. But NGOs are estimating that this number is closer to 14,000. And of course, given the nature of people moving around not just the city and the metro but also further afield, at that moment in time it would then of course be very difficult for people to be given a return date. So at this point, yes, they are indeed using the Johnson & Johnson vaccines. It's a one shot, and a short while ago we were inside the site just behind me. It's a pity I can't actually take you in there, the reception is very poor, but we actually spoke to quite a number of the homeless who had actually come in, many of them telling us that they did not have ID documents. Some concerns were raised, for example, would they be able to get this vaccine for free? Other people were concerned about whether indeed it was safe to do so. And of course, the NGO space and those working in the space worked very hard, as well as very closely with the department to ensure that education campaigns are rolled out to the homeless in terms of COVID-19, but also about the vaccines themselves. So at this point, I can tell you, I don't know how static our camera is at the moment, but just to my left over here, if I can take a walk around, you'll see there are registration points taking place, and at the moment, just to my left, of course, one of the people being registered at the moment at this registration point. You'll see, of course, there are data capturers, and they are assisting some of the people walking in here at the Hope Exchange. Of course, this is where all their personal information which they do have will be taken down. They'll then, of course, from here be moved inside where they will be given their jab, and then a 15-minute break, as is with everybody receiving a jab, of course, will then finalize their process. A very short while ago also, when we spoke to Reverend Annie Kirk from the Hope Exchange, saying that one of the issues that they did have with the homeless population is that there always seemed to be a mistrust of authorities, and that is, of course, where the relationships built with the homeless shelters and the NGOs working in the homeless sector, communicating the message of government to those that make use of these shelters, for whether it's ablutions, whether it is for staying over for the night, whether it is for meals. That partnership has actually come together to the point now where we have seen that there isn't the kind of hesitancy that was initially expected for today, at least, because at this point more than half of the vaccine doses have already been taken up, and as we stand still, yet more people are coming in to this one centre. There are actually 9 other centres across Cape Town, one in Mbombo. We understand from Dr. Karim that yesterday 100 doses were made available, as well as today also another 100 doses. So this is indeed a project that they're hoping will be taking place on a weekly basis to reach as many of the homeless population as possible across the Western Cape.
Excellent stuff. Thank you so much, Vanessa.